Now NBC5 responds. For months, medical providers who take care of active military, veterans, and their families say that their bills have not been paid. And as a result, patients were not getting the care that they needed. PJ Randhawa has the latest on why military members and their families may now face new hurdles in getting this access to specialized medical care.
Military health insurance in Illinois is provided by a federal military insurance provider called TriWest. And we've learned the program has experienced significant delays since restructuring in early 2025. We started investigating payment delays in February and already helped one medical clinic get tens of thousands of dollars in claims paid. The results? This behavioral health clinic in Lake Forest can afford to stay open and provide specialty medical services to military members and their families. But that's not the case for many medical providers nationwide who accept this insurance. Many other providers are now asking patients to pay for care up front. On TikTok, one woman with PTSD tells NBC5 Responds her claims haven't been paid since December, and she's currently paying full price for her sessions, so her provider can keep seeing her and pay her own bills and not go out of business. Another woman with a chronic illness shares she needs thousands of dollars in lab work, but insurance isn't paying doctors or approving referrals, and she can't risk thousands of dollars to pay out of pocket and wait for reimbursement herself. Sophia Schlane, clinical director of 360-degree wellness and coaching, says TriWest has also added hurdles for patients and providers when it comes to getting insurance authorizations for new or continuing treatment. In the past, getting treatment authorized meant Schlane could see a patient for up to 24 sessions. Now Schlane says the length and frequency of treatment must be approved much more frequently, creating delays for patients who need services.
More than half of our patients need new authorizations by March 31st. In order to get those authorizations, they have to do 3 different touch points over at the federal hospital to get that authorization. And then in addition, we need to write up a blurb explaining the medical necessity for them getting that additional authorization.
And she says TriWest hasn't explained the new changes to patients either.
So if it's taking this much time to get those authorizations, and people aren't being informed about the authorizations, and now they're giving you a ridiculous deadline that's essentially a week out, that's a real issue. These people need their services. They need those services to go off smoothly.
In a statement, TriWest told us it expedited the review and payment of claims from 360-degree wellness and coaching as a result of our reporting. It also told us it's processed more than 25,000 claims in Illinois and 3.5 million claims nationwide since January. It says it's processing more than 91% of claims within 30 days. PJ Randhawa, NBC5 responds.
Thanks.